Systemic lupus erythematosus is an autoimmune disease that can affect any body system, involves a chronic state of minimal symptoms and acute flare-ups. Meet Carly, a 34-year-old woman. The past 3 weeks she has been experiencing a rash across her cheeks and nose, fatigue, fever, and really painful swollen-looking joints. She stated she has had some ulcers in her mouth and a big change in appetite to where she isn't hungry. She also has experienced a weight loss of about 10 pounds. Carly realizes that these symptoms are unexplained and she decides to go to the doctor and explain the changes. She is diagnosed by her doctor with an assessment of symptoms determining if she has 4 out of 11 serial symptoms, history, a CBC, an anti-nuclear antibody test, X-rays and a physical exam. Follow up with a rheumatologist for definitive diagnosis. The cause is still unknown, but research shows estrogen and genetics might play a role. SLE develops when the immune system starts to develop antibodies to its own cells. Nuclear antigens and B cells begin to overproduce antibodies. Then antibodies and antigens form complexes and may get trapped in capillaries of visceral structures, which is why it can cause stroke, MI, renal damage, nephritis, psychosis, seizures, hypertension, pericarditis and dysrhythmias. Antibodies then work to destroy host cells. Unfortunately, Carly was diagnosed with SLE and there is no cure, only management of disease. Pharmacological treatment options for her include immunosuppressants, antimalarial drugs like hydroxychloroquine, corticosteroids, over-the-counter NSAIDs for inflammation, calcium and vitamin D supplements. Also medication for hypertension, anemia and kidney disease might be needed later on. In SLE it is very hard to diagnose because every patient looks different and in the early stages it looks like other illnesses. The earliest manifestation is arthritic joints. SLE may cause other autoimmune disorders involving multi-systems in the body. Carly should avoid sun exposure, wear sunscreen, protective clothes, consult for a diet that can decrease cardiovascular disease, stop smoking, seek routine health screening. Due to the risk for involvement of multiple organ systems, osteoporosis screenings if on corticosteroids and if on immunosuppressants monitor for signs and symptoms of infection.